នៅដើមឆ្នាំ2020ជាពេលដែលជំងឺរាតត្បាតសកល COVID-19 បានកើតឡើងជុំវិញពិភពលោកក្នុងនោះក៏មានកម្ពុជាផងដែរកម្ពុជាបានខិតខំយ៉ាងខ្លាំងក្នុងការប្រយុទ្ធប្រឆាំងនឹងជំងឺនេះដែលធ្វើឲ្យប្រធានអង្គការសុខភាពពិភពលោក WHO សរសើររដ្ឋាភិបាលកម្ពុជាថាបានចាត់វិធានការរឹងមាំបានទាន់ពេលវេលាយ៉ាងមានប្រសិទ្ធភាពដើម្បីទប់ស្កាត់កុំឲ្យមានការឆ្លង COVID-19 តាមរយៈបណ្ដាញ Twitter របស់អង្គការសុខភាពពិភពលោក Tedros Adhanom ដែលជាប្រធានអង្គការសុខភាពពិភពលោកបានបញ្ជាក់នៅក្នុងសន្និសីទសារព័ត៌មានកាលពីថ្ងៃទី27ខែកុម្ភៈថាប្រទេសចំនួន8ក្នុងនោះមានប្រទេសកម្ពុជាផងដែលក្នុងរយៈពេលជាង2សប្តាហ៍ក្នុងខែកុម្ភៈឆ្នាំ2020គ្មានសេចក្តីរាយការណ៍ណាមួយអំពីការឆ្លងវីរុស COVID-19 នោះឡើយក្រោយពីមានការសរសើរនៅក្នុងខែកុម្ភៈពីប្រធានអង្គការសុខភាពពិភពលោកជាញឹកញាប់កម្ពុជាតែងតែទទួលបានការកោតសរសើរនិងការលើកទឹកចិត្តជាបន្តបន្ទាប់ចំពោះចំណាត់ការដ៏ល្អរបស់ខ្លួនក្នុងការប្រយុទ្ធប្រឆាំងនឹងជំងឺ COVID-19 ពីសំណាក់អង្គការសុខភាពពិភពលោកតំណាងអង្គការនេះប្រចាំនៅកម្ពុជាមេដឹកនាំនៃប្រទេសជាច្រើនទៀតនៅលើពិភពលោករួមទាំងប្រជាជនកម្ពុជាផងដែរបន្ទាប់មកទៀតនៅពេលកម្ពុជាមានការកើតឡើងនៅព្រឹត្តិការណ៍3វិច្ឆិកាតាក់ទងទៅនឹងរដ្ឋមន្ត្រីការបរទេសហុងគ្រីមកទស្សនកិច្ចនៅកម្ពុជាហើយមានករណីឆ្លង COVID-19 នោះក៏មានការលើកឡើងពីតំណាងអង្គការសុខភាពពិភពលោកផងដែរជុំវិញព្រឹត្តិការណ៍នេះដោយរដ្ឋាភិបាលកម្ពុជាបានគ្រប់គ្រងនៅស្ថានភាពនេះបានយ៉ាងល្អនិងទទួលបានជោគជ័យក្នុងព្រឹត្តិការណ៍3វិច្ឆិកាភ្លាមៗនោះតំណាងអង្គការសុខភាពពិភពលោកប្រចាំតំបន់អាស៊ីប៉ាស៊ីហ្វិកខាងលិចនិងប្រចាំនៅកម្ពុជាបានផ្ញើសារអបអរសាទរនិងកោតសរសើរសម្រាប់សមត្ថភាពរបស់ប្រទេសកម្ពុជាគ្រប់គ្រងបានយ៉ាងល្អចំពោះព្រឹត្តិការណ៍3វិច្ឆិកាលោកវិជ្ជបណ្ឌិតតាគឺស៊ីកាសៃអគ្គនាយកអង្គការសុខភាពពិភពលោកប្រចាំតំបន់អាស៊ីប៉ាស៊ីហ្វិកបានសរសេរតាមរយៈបណ្ដាញទំនាក់ទំនង Twitter កាលពីថ្ងៃទី10ខែវិច្ឆិកាដោយចាត់ទុកសមត្ថភាពក្នុងការគ្រប់គ្រងព្រឹត្តិការណ៍3វិច្ឆិការបស់ថ្នាក់ដឹកនាំប្រទេសកម្ពុជាថាជាគំរូក្នុងការអនុវត្តសុខភាពសាធារណៈចំណែកលោកស្រីវិជ្ជបណ្ឌិត Lee Island តំណាងអង្គការសុខភាពពិភពលោកប្រចាំនៅកម្ពុជាក៏បានផ្ញើសារតាមរយៈបណ្ដាញទំនាក់ទំនង Twitter នៅថ្ងៃទី21ខែវិច្ឆិកាអបអរសាទរកម្ពុជាដែលគ្រប់គ្រងស្ថានភាពបានល្អលោកស្រីថាការអនុវត្តតាក់ទងទៅនឹងព្រឹត្តិការណ៍3វិច្ឆិកាមានដូចជាការតាមរកអ្នកជាប់ពាក់ព័ន្ធក្នុងព្រឹត្តិការណ៍3វិច្ឆិកាការឆ្លើយតបយ៉ាងរហ័សនិងចាត់វិធានការអន្តរាគមន៍ចំគោលដៅគឺជាចំណុចសំខាន់នាំទៅរកជោគជ័យគ្រប់គ្រងស្ថានភាពបានយ៉ាងល្អតាក់ទងទៅនឹងព្រឹត្តិការណ៍3វិច្ឆិកានេះដែររបាយការណ៍វិតម្លៃមួយរបស់ការិយាល័យចក្ខុវិស័យសេដ្ឋកិច្ចនៃប្រទេសសេនេហ្គាល់ស្ដីអំពីសន្ទុះនៃស្ថានភាពធ្ងន់ធ្ងរនៃជំងឺ COVID-19 បានដាក់ចំណាត់ថ្នាក់ឲ្យកម្ពុជាជាប់លេខ3ក្នុងពិភពលោកក្នុងចំណោម166ប្រទេសនិងលេខ1នៅអាស៊ីជាប្រទេសដែលមានស្ថានភាពគ្រប់គ្រងជំងឺ COVID-19 និងផលប៉ះពាល់ពីជំងឺនេះបានយ៉ាងល្អជាងគេទន្ទឹមនឹងមានការសរសើរស្ទើរតែអស់រយៈពេលជាង11ខែក្នុងការប្រយុទ្ធប្រឆាំងនឹងជំងឺ COVID-19 របស់រដ្ឋាភិបាលកម្ពុជាបានយ៉ាងល្អ COVID-19 នៅតែមិនទៅណាឆ្ងាយពីកម្ពុជាឡើយពលគឺនៅថ្ងៃទី28ខែវិច្ឆិកាកន្លងទៅនេះកម្ពុជាកើតឡើងនៅករណីឆ្លង COVID-19 ក្នុងសហគមន៍លើកដំបូងដែលសម្ដេចនាយករដ្ឋមន្ត្រីហ៊ុនសែនដាក់ឈ្មោះថាព្រឹត្តិការណ៍សហគមន៍28វិច្ឆិកានៅចំពោះមុខបញ្ហាដ៏ធំនេះប្រមុខរដ្ឋាភិបាលនិងក្រសួងសុខាភិបាលព្រមទាំងស្ថាប័នពាក់ព័ន្ធបានចាត់វិធានការយ៉ាងរហ័សនិងម៉ឺងម៉ាត់ដើម្បីកុំឲ្យមានការរីករាលដាលទ្រង់ទ្រាយធំទាក់ទងទៅនឹងព្រឹត្តិការណ៍28វិច្ឆិកានេះលោកស្រីវិជ្ជបណ្ឌិត Lee Island តំណាងអង្គការសុខភាពពិភពលោកប្រចាំកម្ពុជាកាលពីថ្ងៃទី6ខែធ្នូនៅលើបណ្ដាញសង្គម Twitter របស់លោកស្រីបានលើកឡើងថាកម្ពុជាបានខិតខំខ្លាំងណាស់ដើម្បីគ្រប់គ្រងឲ្យបាននៅការចម្លងក្នុងសហគមន៍លើកដំបូងចាប់តាំងពីថ្ងៃទី28ខែវិច្ឆិកាឆ្នាំ2020មកលោកស្រីថាការចូលរួមទាំងអស់គ្នាការសាមគ្គីគ្នាប្រកាសជាអាចទប់ស្កាត់នៅការចម្លងទ្រង់ទ្រាយធំក្នុងសហគមន៍បានអស់រយៈពេល1ឆ្នាំមកហើយដែលកម្ពុជាប្រយុទ្ធប្រឆាំងទៅនឹង COVID-19 រដ្ឋាភិបាលកម្ពុជាបានខិតខំប្រឹងប្រែងយ៉ាងក្រៃលែងក្នុងការទប់ស្កាត់នៅជំងឺដ៏កាចសាហាវមួយនេះអង្គការសុខភាពពិភពលោកតែងតែសរសើរចំពោះចំណាត់ការនិងវិធានការដ៏ទាន់ពេលវេលារបស់កម្ពុជាក្នុងការទប់ស្កាត់ទៅនឹង COVID-19 នៅថ្ងៃនេះយើងមានការចូលរួមពិសេសពីភ្ញៀវកិត្តិយសរបស់យើងគឺលោកស្រី Lee Island តំណាងអង្គការសុខភាពពិភពលោកប្រចាំនៅកម្ពុជា Today we have a great honor to be joined by Dr. Lee Island, WHO representative to Cambodia. ជំរាបសួរលោកស្រី
ជំរាបសួរ
They have a seat. Thank you so much, Doctor, for joining us today.
Thank you.
So, as you know, it's almost 1 year that the world, including Cambodia, have faced in the crisis of the COVID-19. And WHO always press Cambodia that do very good on the controlling and managing the COVID-19. How do you assess Cambodia's effort in coping or fighting the COVID-19 pandemic?
Extraordinary or remarkable. Cambodia's efforts in fighting against COVID-19 have been really extraordinary. The results have been amazing. Let's speak with data. As you all know that globally, more than 69 million confirmed cases, with more than 1.5 million deaths, have been reported to the World Health Organization. This is very unfortunately. However, in Cambodia, we are fortunate. As of today, we only have less than 400 cases with 0 deaths, no healthcare workers infected. It is remarkable for Cambodia. Let me explain why I said it's extraordinary. I have 3 reasons. 1, early detection and the rapid response to all the cases. Second, proactive preparedness for all the community level transmission. And lastly, solidarity and cooperation. I can explain a little bit more detail. First one, early detection and the rapid response. You know that Cambodia has invested core public health system over past year. You have more than 3,000 rapid response team members. They work round clock to detect all the cases, response quickly. In Cambodia, none of us will ever forget 3 events. One is the Western Dam cruise ship event in February. Second, November 3 event related to a diplomatic visit. And then 3, recently, we have 28 November community level transmission event. All so far, response has been extraordinary, very good. Second, proactive preparedness for the larger scale community level transmission. Cambodia has been working for months to prepare for that worst case scenario. And I can tell you a lot of progress has been made. Let me just single out one example, laboratory testing. I remember back to January, we could only do the lab testing, if I may say, around 500 samples per day. Do you know how many samples we can do it? Now, more than 3,000 per day. This is amazing achievement to prepare for the COVID response. Lastly, very important in Cambodia, solidarity and cooperation. Cambodia has activated the whole of government response and the whole of the society. And WHO also working very closely with partners to support Cambodia. We work as one team. Our common goal is fight for virus. We never fight each other. We fight for virus. This is 3 reasons why I said extraordinary in Cambodia.
In spite the press of that the Cambodia refused from the WHO, so what is your opinion that Cambodia should improve its strategy in order to fight against the coronavirus?
You're right. It's not impossible to do the good response, but it's impossible to do perfect response. Cambodia also had a lot of lessons. There are a lot of challenges that we have to manage, and there are a lot of room to be improved. Allow me to highlight 3 things that Cambodia may consider in terms of moving forward. 1, Cambodia does need to invest preparedness or pandemic preparedness, including local preparedness. We all know that the good response is the one we prepared. And we don't want to be regret when the outbreak happens. We want to do before the outbreak happens. That's the number one. We need to invest pandemic preparedness. Second, we need to engage more community and protect the vulnerable population. Community participation to understand their voice, their needs is very important. And they can be part of fighter together with us for the COVID response. Protect the vulnerable population is so important. We are from health sector. We want to make sure all the people can have the right to access all the essential services. We have migrant workers, garment factory workers, women and the girls, and those living in the prison setting. All these are important vulnerable population for us to take care. I think we can do more. The third one is working for the future. We are so busy with our everyday response, but we have a lot of challenge will come to us tomorrow. So we have to act today to address the challenge tomorrow. For example, NCD, non-communicable diseases. I saw when I visit together with Her Excellency Dr. Wang Ding and the Ministry of Health colleague, I visit proudly, I visit 18 provinces already.
Yeah, sure.
In addition to COVID health system, I saw many more NCD patients in the hospital. I'm worried about future. If we have NCD tsunami, how we are going to do? I think we should take an action today to act to address the tomorrow, the challenge in tomorrow.
Okay. Thank you for your answer. I want to talk about the vaccine because the Prime Minister planned to buy the vaccine. So I want to know about your opinion. What is your opinion on the Cambodia's planning to buy the vaccine, especially about the vaccine distribution? Yeah.
First of all, let me say this is amazing progress in the history of the vaccine development. Can you believe we have vaccine already within a year? This is very unusual in the history. So we are so happy to see all this good news. And we are also even more than happy to see Cambodia readiness for receiving vaccine. You know that Cambodia has been working proactively to develop so-called national deployment and vaccination plan. This plan highlights the priority group, how we are going to do, how much money we needed, and I'm very grateful to see the bigger progress here. And recently, we all noticed the announcement by Sandam Prime Minister about how Cambodia has been addressing funding gap. Amazing. So now we mobilize a lot of funding. This is all good news. However, I want to emphasize that as of today, there's no WHO recommended vaccine, so-called pre-qualified vaccine for all the country yet. This is important to make sure safety and efficacy. Secondly, the vaccine supply globally will be very limited. There's no way for Cambodia to receive vaccine quickly with all the doses we needed for all population. We have to prioritize. How to prioritize will be the big question for the Cambodia, put on the table, make the consensus why we prioritize this group. WHO has been recommending the Ministry of Health to prioritize healthcare workers because healthcare workers need to provide essential health services to others. It's not like protect themselves. Of course, protect themselves, but more important, protect others. Secondly, those with if I may say, those elderly, and thirdly, those people with chronic condition. However, WHO policy can be adapted based on the local context, local needs. In some countries, they may prioritize some essential social workers. And I understand the discussion is ongoing in Cambodia.
I saw your Twitter, you tweet on your Twitter last week that you said that however the world we have the vaccine, including Cambodia, but it doesn't mean that, you say that it doesn't mean that the coronavirus pandemic will end. So what do you mean by that?
Thank you for paying attention to my Twitter message. That's correct.
Yeah.
On the one hand, we are very happy to have this additional public health tool we call vaccine. However, on the other hand, vaccine itself alone will not end pandemic. So that's very clear.
People they think that when we have vaccine, everything is finished.
That's not correct, if I may say frankly.
Okay.
Because the best measures, best way to end the pandemic is combine all of the available tools. And we cannot stop our existing tool to wait for the vaccine that still have not arrived yet. Even after your arrival, it will be arrival step by step. So in this case, we need to continue our usual public health measures. I repeat again and again. So hand washing, cough etiquette, physical distancing. I will mention later on a little bit if you wish. Avoid the high-risk places. This is very important to be continued. Otherwise, we may face the danger of the outbreak again.
What is your opinion and your suggestion and your constant advice to the Cambodian public?
Thank you, public. First of all, I want to say thank you also on behalf of World Health Organization for the great effort that Cambodia public has been made over past months. I am very aware that, including myself, as one of member of public, we have been tied off, and sometimes we feel the pandemic fatigue. I understand. However, virus is still around us. So my advice will be very simple way. We all want to staying in a safe and more secure Cambodia. But government alone cannot do it. Health sector alone cannot do it. We need all the public to join to create a safe Cambodia. And COVID tells us one simple reason. Why? Because collective health and safety are based on individual actions. If I may allow, please do not be tired of me. I really want to remind Cambodia again to exercise I call 3 Bs and the 3 Cs. 3B means be vigilant. We still have to keep an eye what's happening in the world and in Cambodia. Be ready for response. As I mentioned that government alone cannot do it. Public are part of responder, part of hero to protect yourself, your family, and community. So you have to be ready for response. Then thirdly, be a champion to exercise new normal. For example, one example, new normal, maybe people do not understand, but let's say I am wearing mask today. It's not because I want to mainly protect myself. No, I want to protect you. That's why I'm wearing the mask. So this is a change of the mindset as the new normal. 3C, I repeat again, avoid 3C where the virus spread most. For example, crowded places with many people. That's the first C. Second C, close contact setting, like a karaoke bar. You're singing, you're laughing, you're shouting, you're hugging. For almost overnight, for whole night, it's very dangerous setting. The third C is the confined space where with very poor ventilation. If you go to independent monument, it's open air and exercise physical distance. If we don't have larger scale outbreak, it's safer. Then you go to other places, for example. So in short, I think solidarity again, if all the public join together, you can create the safe Cambodia that you want to save.
You just said solidarity. So Cambodia have enough that the people solidarity with the solidarity?
I think in the world, nothing perfect. But Cambodia has been exercising solidarity well. I remember in the March and April, when government issued certain measures, everybody complied. And we were able to stop local transmission quickly. However, after months, people getting tired, then the public complacency become the dangerous. So I myself also tired sometimes, but we have to continue to show our solidarity not only protect yourself, but protect the people who are living with you and protect society. We need to show greater responsibility, social responsibility.
Thank you so much for your answer. And what is your final message for the next year, 2021?
2021, to my view, will be a very special year for the human history and for Cambodia. Why? Firstly, we have to live with COVID for a while, as we mentioned that. I do not think we can end the pandemic quickly. The virus is still not far away from us. We have to be smart to fight COVID. Secondly, next year will be the year of the opportunity to shape the future we want to see. And to do that one, at least in the World Health Organization, my own team, I really encourage everyone to do the rethink, reimagine, refocus, and redesign our work for the future. So in short, it might be the difficult year again, but it's the year that we can see light, shape for the future, and I am very confident and looking forward to another successful year in Cambodia, so that all the people in Cambodia, including foreigners like me, can enjoy safe, healthy, and happy 2021. And all my best wishes to all the Cambodia. And I also want to take in this opportunity to say thank you, the BTK, all the colleagues, for your hard work to disseminate correct information. You know, misinformation is a big issue. And the public has a right to access to right information. The journalists, media, like you, are also professional. You can play that role. So I want to say thank you for that and all the best.
Thank you very much, Dr. Lee Island, for joining us today. Thank you. Okun Charan.
All the best to all the Cambodia. Akun Cha.
Okun.